So for this Ergo workshop, we're gonna go through basically lifting techniques, or just basically how to lift a safe and proper way, and basically the injuries that could come along with. We'll start with the injuries that you could see. So you can see on this picture, what you could be worried about, if you injure your back, would be a strain, which is the muscles. So you're straining the muscles. A sprain, which would be the ligaments. For example, would be your SI joints. A herniation would be like a disc herniation, and a fracture. So the vast majority of the time, you're looking at one of those four things if you do get hurt. For the muscle, so you can see I color-coded it here. For the muscle in the green, this is usually where you're going to feel the pain, is right along the sides of your spine. Usually not on your spine or too much lower. You could get it higher up the back, but most of the time it's going to be this low back and those paraspinal muscles. Now for a sprain, you're looking at your ligaments. So most of the time it's going to be in your SI joint, which, if you know, like you got like two little dimples on the back of your back here, in this area, that's usually where you're going to feel the pain, if it's in the SI, like an SI joint sprain. If you do feel pain in your back, this is basically what you're hoping it is. It's just a strain. This is still pretty common, your SI joint sprain. When you get over to a disc herniation and a fracture, those become a little more serious. It doesn't necessarily mean it's like surgery or anything like that. It's just a little more goes into it. So for a fracture, there's something called a spondy for short, or they call it a spondylolisthesis if the bones are shifted at all too. But that is, you have your vertebrae right here, and if you're doing a lot of extension, you can put pressure right in these areas, and then it could start with a stress fracture and then eventually lead to a fracture. You're gonna feel that pain like localized to wherever it actually happens on your spine. Usually it's in that lumbar area, the low area. Now when you get into a disc herniation, what's happening is you have the discs between your vertebrae, and what will happen, it'll protrude out towards the back, and it'll start pinching on your spinal cord. The pain that you're going to feel from that is actually, you're not going to feel too much pain in your back. You're going to feel that pain radiating down, like in your butt cheek and down your legs. Yeah, okay, so another thing to keep in mind is, just because you feel any one of these pain points isn't necessarily going to tell you what it is, because you could have multiple or all of these going on at the same time. A lot of times when you do have a strain, you'll have some pain in the SI joints, and you could also have a herniation and a fracture. They could all be put together, but this is just a good indication of, if this is where you feel the pain, this might be what's going on. Now I might come back to this slide if I have time to talk about what you can do to recover from these. So for lifting, I'm sure everyone here has heard of the power zone. So that's what we have on the left side here. Ignore the weights here. This is a recommendation from the CDC, I think, of 50 pounds, but at Schneider it's 26 pounds. And you basically want to keep the weight between like mid-thigh and mid-chest. That's going to be the most ideal spot for it. So as you can see, you don't want to be extending out into that yellow area, or going down to the ground if possible, or up above your shoulders, because that's going to put you in that danger area. So for these points on the right, the first thing you want to think about doing is a hip hinge when you're going to pick something up. So a hip hinge just means when you're bending over, you're bending at your hips. So instead of bending your back down and putting it in a curved position, you want to keep your core braced, which is going to be the second one. So your core braced, so your spine isn't moving, and then you're going to bend at your hips. That makes sense? So So you're not gonna be bending down, you know, flexing your spine. You're gonna keep the core braced, bend at your hips. The next thing is you're gonna squat down. So if it's something off of a table, then you can, again, just do that hip hinge, you know, bring it close to you and pick it up. But if it's something on the ground, you're gonna actually squat down and pick it up. Again, the same thing, you're bracing your core, you're doing the hip hinge, and you're going down to get it and back up. Lift with your legs. So again, same thing. If you're down here, you're not gonna use your spine to curl something up. That's when you're gonna injure it. And that's more when you're gonna see the, like a disc injury, is if you're putting your spine under load in that flexed position. So always remember to keep your core braced. And the last thing is just avoid twisting under that load. So again, if you're picking something up from down here, you want to put it to the table. You don't want to pick it up and then twist under load, because that's going to, again, taking your spine out of that braced position and more likely for injury. So what you want to do is you want to twist with your legs. So you want to turn your legs that way and place it down. Any questions with any of that so far? So what I did before, I asked for any volunteers last time. No one wanted to volunteer. Anyone want to volunteer to pick something up? I can critique it. Drew?
I think Katie does this time.
I'll do it.
Yeah, okay. So I'm going to have Katie pick up a couple things, and then I want to see if you could point out what she might be doing wrong, or if she's doing it perfectly fine. So,
So we try to do it right?
This is
or
empty.
Just do it.
yeah, just however you would do.
Okay. Knowing that I know it's empty, or
Yeah,
pretending it's heavy?
Yeah, let's pretend it's like that 25 pounds. Like it's,
Put the weight in it again?
I could actually make it, because I have a 25 pound. Okay, wait, so do that again. Okay. And did you see anything wrong there?
Put the weight in it, because I was in your position. I was in your position last time.
Okay.
It's harder to do it empty.
Okay.
At least
Does it feel like,
it'll be 25 pounds.
Yeah, I mean,
okay.
it feels heavy as a dumbbell, but it is only 25 pounds. Okay. Shifting it. Not bad. Did you guys see anything wrong with that?
It's all good stuff.
Good stuff? Alright, what'd you see? What good stuff?
Keeping the back straight,
Yep. Squatting down.
squatting.
Okay. The first thing I would say, you put it back down now. So now this isn't a big problem, but just a little thing I noticed, so I'll point it out. When she picked it up, it was out in front of her a little bit, and you really want to get that as close to your center of gravity as possible when you pick it up. So instead of like coming out here, reaching forward, picking it up, and then bringing it close to you, think about getting your body as much over it as possible. And then getting down, getting a good grip, and coming straight up. If the box or whatever you're picking up isn't coming straight up, then you should be able to adjust to make it better. That makes any sense? So if you're looking in a line there, and you see the box come up this way and then closer to me, then it's not the most efficient or safe way. So if I'm out here and I pick it up, and then I bring it closer, that position when I'm out here, I'm putting my spine under more stress. Make sense? Yes?
What if you have bad knees?
Well, if you're lifting properly with like good squatting technique, then it shouldn't put too much stress on your knees. So if you have bad knees, it's probably because you've been doing something the wrong way up to this point, or you got into like a car accident or something like that. You know what I'm saying?
Or you're old.
Or you're old.
Or you're old.
But even in that case, it just means like you might have been doing something wrong,
Right.
you know, to get to that point. All right.
You can always ask for help too.
So another one.
Oh, I'm still going.
So think about this as like probably more heavier than it is.
Okay.
But don't think about this as like a box of items. Just like, this is just a heavy object on the ground. This is more like this is an awkward object. What would you do with it? So how would you pick this up?
Maybe something like this. It was heavy.
Okay, anyone have any suggestions?
Yeah, I don't know.
Hands underneath, maybe?
It's like two.
Yep, you definitely want to get a good grip on it. You don't want to be pinching it.
Like
You
in the
have the right
center,
idea,
maybe?
at least in terms of
Yeah, like that.
bringing it to, like the first time you did it.
Yeah, it was like.
You
so, like,
dragged
kinda
it, but.
slide it.
Yeah,
Kinda
you,
like,
you
yeah.
kind of have the right idea.
Yeah, yeah. 'Cause
Or I guess just like to move it up like this. Like to.
And now,
Yeah, so
Now you-
basically that's the idea. That's what I wanted to get across. So when if it's down like this, obviously this is something light, it's gonna be hard to injure yourself. But if you're going to pick it up, the center of gravity is already further away from you than a box would be, or if you're picking up one single item. So if the center of gravity is here, and that's as close as you can get it, if you flip it up towards you, then you're bringing that center of gravity closer to you. And then you can get a good grip and come back up with it. If something is big like this and heavy, even if it's 26 pounds or less, and you don't feel comfortable picking it up, then that'd be a good time to ask somebody else for help. Well, let's see, okay. Thank you for volunteering. Okay, so just some of the things that you can do if you are experiencing these. A lot of them are going to be treated in a similar way, and that's just doing core exercises, strengthening your core, and not making something worse, if that makes sense. Like I said, if you do have back pain, a strain is really what you're hoping it is. It's just muscular. That heals the best and the quickest. Something to keep in mind, if it's a strain, you can do light stretching with it. If it's a sprain for your SI joint, that's because you overstretch the ligaments. So stretching, if you're stretching the ligaments, you could actually be making something worse. So that's why it's important to know the difference, or have someone like me who could, tell you whether it's a strain or a sprain. Because you might want to stretch in this situation, but you don't want to be stretching in a situation where it could be your SI joint. Now, if you have a fracture, so this one did actually make a complete fracture, but a lot of times you'll get like a stress fracture in your back, which could lead to that pain, and it doesn't necessarily mean anything like surgery or anything like that. It just means you need to figure out what you're doing and avoid doing that. This usually comes from an overuse injury of being in an extended position. So if you have like an anterior pelvic tilt, that's what you call it, and your hips always down, so your spine's always in that extended position, and then you're doing that under load, then that's when something like that could happen. For a disc herniation, there's something called the McKenzie extension program. And what it is if you usually get this because you're in a flexed position all the time, which is like if you're hunched over, sitting or standing, or if you're picking something up, like I said, with that curled spine, then you could risk getting something like that. But the McKenzie extension exercises are actually doing exercises where you're extending your spine. And what's actually happening is you're extending your spine, this is the back of it, and you're kind of pinching the disc back into place, if that makes sense. So these are your two vertebrae, and this is the backside. When you do those exercises, you're actually pinching it back into place so it's not pressing on that nerve anymore. That's one of those things where once it starts happening, you're more prone to it. So anytime you would feel that pain, you would want to do more of those extension exercises, or just kind of keep up with it all the time. Any questions on that?
What about heat? Like for a strain?
Heat can definitely help. For
Like
a
a
strain,
strain?
you typically don't want to use heat for the first 24 to 48 hours, because that's when you're in the inflammation phase, and heat's
Okay.
just gonna make it more inflamed. Once you get past that 24 to 48 hours, then heat's fine.
Okay.
It's more to make it feel better, to be honest with you. It doesn't necessarily heal anything.
Do anything?
Yeah.
Okay.
It's the same kind of idea with ice, too. Like, you're okay to use ice in the first, really at any point, immediately at any point. But it's more to kind of just numb the pain, make it feel better. It doesn't necessarily speed up any recovery. Any more questions on any of this?
Does getting a cortisone shot in that SI joint, does that help that inflammation? I mean, I've had that done to me before, in that SI joint in the
Yeah.
back.
Yeah,
And-
it does, but it's not like a long-term solution.
Right.
Usually, I mean, if you go to a doctor and they give you a cortisone shot, they should say, all right, this is going to help with the pain and kind of like might last for a month or two. But during that time, you should be doing exercises to strengthen your core and avoid putting strain on the SI joint. I know there was a good question earlier. Do you remember what that was about? Someone was asked. Oh, someone asked about back braces. I typically don't recommend back braces. I don't really like them. For one particular movement, if you're wearing a back brace, it could help you, prevent some kind of injury. But if you're wearing a back brace all the time, you start getting reliant on it. Your core starts to not activate or be as strong when it needs to. And then what happens is if you're not wearing the brace, whether you're at home or at work or doing something else, and then you could pick up something light from the floor, and then that's when you're going to get injured because your core is not ready for it, and then you end up coming to work, and then your back hurts anyways. So I'm not going to tell anybody not to wear a back brace, but I really don't recommend it. Any other questions? No? Okay, well, I gotta go. So, thanks for coming. I hope that was helpful.